Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, fever is common in children. Fever is a normal response to many illnesses, the most common being an infection in the body. Well, fever itself is usually not harmful. In fact, it helps the body's immune system to fight off the infections. Now, while fevers can be concerning for parents, doctors will usually be more concerned about what is causing the fever and not what the child's temperature is. It is more important for you to monitor any symptoms of underlying illnesses rather than the fever itself. So to discuss on the topic, we are being joined today by Dr. Mridu Plaban Borah, Pediatrician from 𝗟𝗡𝗥𝗧𝗛𝗘 Hospital. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Well, thank you so much, Doctor, for joining to Good Life, the health show today. So today, the topic which we have taken is very common seen among the children, and what tips we are going to give the parents, what are the do's and don'ts the parents have to follow, we are going to discuss in our entire episode. Now, first off, what is fever in child and what are the types of fever in child? What would you like to tell, doctor?
Yeah, thank you so much for being invited me to this show, and after a long time actually I must thank that you have chosen a very good topic of fever in children. To be very frank, actually fever is a symptoms. Many times actually parents, they call up with they do panic actually because of the fever. Sometimes the fever comes every 4 hourly, 6 hourly, 1 hourly, whatever. So fever is a symptoms basically. So fever, the cause of fever may be varied from a mild viral illness to a severe bacterial infections. Or it can be some other underlying diseases which is not at all infections, or which is not at all a pneumonia or urinary tract infections or any other else. So fever is basically a symptoms. We have to look into the fever very properly, because we can grade the fever in a different ways. So it can be of very mild grade of fever, which is less than 101 degree Fahrenheit. It can be a moderate degree of fever, which is 101 to 104 degree Fahrenheit, and severe grade of fever, which we call at when the fever is more than 104 degree Fahrenheit. And if we just see the various causes of fever, actually, I can tell you that most of the time it is seasonal viral cough and cold, which comes first as the viral fever. So we have to analyze the kind of fever actually, whether the fever is associated with running nose or cough, whether the fever is associated with the loose motion, whether the fever is associated with vomiting or headache, or there is some respiratory distress, or if there is associated some earache. So accordingly, we have to justify that why the fever is coming off, whether it is a infection related to the chest, whether it is an infection related to the ear, whether the infection related to our GI system. Like that way, we have to analyze, and accordingly we have to go forward. So most of the time, actually, it is viral, maybe because of the seasonal change, and many times actually it can be associated with severe respiratory tract infection, what we call that pneumonia. So it can be associated with urinary tract infections. There we can find various other symptoms. It can be some brain infection also. We call it as encephalitis or meningitis. So like that way, actually in children we can get various causes which can develop fever, and parents usually comes to us with symptoms that child is having fever, and after that we have to analyze this and we have to go about what is the cause.
All right. Now, doctor, it is very important to know the cause of the fever, then the procedure or the treatment can be started at the earliest, isn't it? Now, if we talk about the things a parent should know about caring children. Now, if they want to know about the basic symptoms that this fever is something else and they should immediately go and see a pediatrician. So what are those symptoms parents will have to know at the earliest?
Yeah. Very nice actually. So first thing is that the seasonal viral cough and cold, the fever is usually very mild. It's usually 101 or 104 like that. That fever can come at 4-hour or 6-hour interval. Sometimes it comes and 3 times a day or 4 times a day. That's all. But what is important is that in viral cough and cold or in the seasonal fever actually, what we find that during the episodes of fever, the cells goes down.
Okay.
Cell becomes lethargic, so cells become inactive, and we give some anti-fever medicines, and cells, when the fever subsides, the cells become immediately very active. There is no interference in actually in his activities and feeding pattern or any other whatever the daily activities. They usually continue with that fever. The thing is that sometimes if we do not give proper treatment or proper nutrition during this period, child becomes more lethargic.
Okay. Sometimes
the fever becomes very high because of some underlying dehydration. So if we do not rehydrate the child, actually with dehydrations, the fever goes very up. So it can be 103, 104 like that. So a minor kind of fever can be severe because of improper hydration to the child.
Okay.
So what we have to think that if it is like that only, that it's okay, it's fine. Okay, we'll give some paracetamol, which fever will subside. And most of the time actually the viral fever usually it goes off within a period of 5 to 7 days.
Okay.
But if you think that the fever is continuing beyond 5 to 7 days, we must concern and we have to approach a doctor.
All right.
The other way around is that
all
if
right,
the fever
doctor,
is severe enough,
all right,
the
doctor,
child has...
We'll continue with the conversation.
Yes.
We have a caller at this point in time. Let's take the call and then we'll proceed with the conversation. Hello? Hello?
Yeah.
All right, we'll try and connect to that caller, but just to tell our viewers that we are having a fruitful discussion on the topic fever, which is seen in children, and what are the do's and don'ts a parent should follow. Our numbers are flashed on your television screen, so if you have any queries regarding the topic we are discussing at this point in time, please call up and ask your question. Now, Doctor, coming back to you again, you were talking about the symptoms which a parent should be careful about their children, and they should immediately go and see a doctor. All right, doctor, we are again connected with the caller. Let's take the call and then we'll talk about the topic. Hello?
Hello?
I'm going to ask you a question.
Yeah.
More Lorato Town, the Dimanaga Jor Husile. That's auto 104 decades of Husile. He's just 1 year, 8 months old. তাৰপিছত তাৰ বডিত মই ওয়াইপিং কৰি থাকিলো ওয়াইপিং কৰি দিয়াৰ পিছত তাৰ টেম্পাৰেচাৰটো কমি যায় কমি গলেও তাৰ তাৰমানে 102 তলত কমা নাছিলে তাৰপিছত প্যাৰাস্টামল দিছিলো প্যাৰাস্টামলটো দিওঁতেও তাৰ কমা নাছিলে তাৰপিছত তাক এন্টিবায়োটিক দিলেহে তাৰ লাহে লাহে কমি গল কিন্তু তাৰ পিছতে তাৰ কফৰ প্ৰবলেম খুব বেছি হৈ গল ধৰিলে তাৰপিছত এতিয়া এইটো কাৰণে হৈছে যে কফটো তাৰ সঘনাই হৈয়ে থাকে
হয় এতিয়া কথাটো হৈছে কি মই আপোনাক এখিনিতে আমি ডেসক্ৰিপচন এটা দি আছিলো যে আমি কেতিয়া পেৰেন্টস হিচাপে কনসাৰ্ন হ'ব লাগে তো ইয়াতে মই কলো যে কিছুমান ভাইৰাল ফিভাৰ আছে যেটো হয়তো দিনটো 3 বাৰ বা 4 বাৰ আহিব পাৰে 5 দিন 6 দিনৰ পিছত জ্বৰটো নাইকিয়া হৈ যায় তো ইউজুৱেলি ভাইৰাল ফিভাৰবোৰৰ যেটো লক্ষণ হেটো 101 বা 102 মানত ফিভাৰ থাকি যায় আমি যেতিয়া দৰব দিও হি কমি যায় আৰু তাৰ অন্য সময়ত তাৰ ফিজিক্যাল এক্টিভিটিবোৰ ঠিকে থাকে ইয়াতে আখিনতে মই লক্ষ্য কৰিব বা ক'ব বিচাৰিছো যে 103 104 ফিভাৰ কিয় হ'বলগীয়া হ'ল তেতিয়া হয়তো আমি সাসপেক্ট কৰিব লাগিব যে হি অকল ভাইৰাল ফিভাৰ নহয় হয়তো তাত আন্ডাৰলাইন অন্য কিবা থাকিব পাৰে দুই নম্বৰ কথা হৈছে কি যে যদি সেইখিনি সময়ত ভালকে হি পানী জানি নাখায় বা হি যদি ডিহাইড্ৰেচন থাকে তেনেহলে আমি দেখা যায় যে যেটো মাইল্ড গ্ৰেডৰ ফিভাৰ থাকে হেতু হয় বেছি পৰিমাণে জ্বৰ আহি থাকিব পাৰে দ্বিতীয় কথা হৈছে আমি জ্বৰতে সীমাবদ্ধ নাথাকি তাৰ আমি আনুষংগিক যিবিলাক লক্ষণ থাকে সেইবিলাক আমি লক্ষ্য কৰিব লাগিব হয়লো তাৰ যদি উশাহ নিশাহত কষ্ট আছে বা বেছিকৈ কাহ হৈ আছে তেনেহলে আমি সাসপেক্ট কৰিব লাগিব যে জ্বৰটো হয়তো তাৰ লাঙৰ ইনফেকচনৰ কাৰণে আহিছে বা যেটোক আমি নিউমোনিয়া বুলি কওঁ কিন্তু আপুনি যেটো কথা উল্লেখ কৰিলে মাত্ৰ যে তাক এন্টিবায়োটিক দিয়াৰ পিছত হি ৰেসপন্ড কৰিলে কিন্তু এইখিনিতে আমি খুব বেছি সাৱধান হৈ থকা উচিত যে আমি যিকোনো ধৰণৰ জ্বৰতে আমি এন্টিবায়োটিক দিয়াটো উচিত নহয় যদিহে আমি যেতিয়ালৈকে কনফাৰ্ম নকৰো যে এটো ব্যাকটেৰিয়াৰ আক্ৰমণৰ কাৰণে তাৰ এটা ইনফেকচন হৈছে যদি আমাৰ এটা কথা বস্তু আমি লক্ষ্য কৰিব লাগিব যে আমি ব্যাকটেৰিয়া যেনেকৈ আছে আমাৰ বায়ুমণ্ডলত বা আমাৰ লগত তেনেকৈ কিন্তু আমাৰ লগত এন্টিবায়োটিক মাত্ৰ কেইটামানহে আছে সেই কেইটামান এন্টিবায়োটিক লৈ আমি গোটেই জীৱনটো চলিব লাগিব গতিকে আমি যিকোনো সময়তে যদি কোনো অৰ্থ নোহোৱাকৈ যদি এন্টিবায়োটিক ইউজ কৰো প্ৰপাৰলি ডায়াগনোসিস নোহোৱাকৈ তেনেহলে কি হ'ব পিছৰ পৰ্যায়ত সেই এন্টিবায়োটিকটো কাম নকৰা হ'ব গতিকে মই আপোনাক এইটো উপদেশ দিম যে তাৰ যেটো এতিয়া চলি থকা কাহ তাৰ কাৰণে আপুনি ডক্টৰৰ পৰামৰ্শ লোৱাটো উচিত হ'ব নাম্বাৰ 1 আৰু 2 নম্বৰতে পিছৰ পৰ্যায়টো কেতিয়াও মানে সঠিক ডায়াগনোসিস নোহোৱালৈকে এন্টিবায়োটিক এটা পটককৈ ইউজ কৰা উচিত নহয় যদিহে তাৰ নিউমোনিয়া হৈছে ডেফিনেটলি তাৰ কাৰণে কিছুমান এন্টিবায়োটিক থাকে বা জ্বৰৰ কাৰণ যদি অন্য কিবা কানৰ ইনফেকচন বা ইউৰিনাৰী ট্ৰেক ইনফেকচন হ'ব পাৰে তাৰ কাৰণেও বেলেগ এন্টিবায়োটিক থাকে সেই মতেহে আমি এন্টিবায়োটিক কনফাৰ্ম কৰি পেলাই এন্টিবায়োটিক ব্যৱহাৰ কৰাটো উচিত হ'ব সো আপোনাৰ শিশুটিক মই ভাবো যে হি আৰোগ্য হৈ উঠক আৰু তেনে ধৰণে তাক যিখিনি সময়ত জ্বৰ হৈ থাকে সেইখিনি সময়ত ভালকৈ পানী বা ওআৰএছ এনেকুৱা ধৰণৰ খুৱাই থাকিব যাতে তাৰ হাইড্ৰেচনটো ভাল থাকে আৰু যাতে জ্বৰৰ মানে মাত্ৰাটো সদায় অধিক হৈ নাযায়
All right, so proper hydration is very important.
Right.
So, doctor, we'll have to just slip into a short break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back. You're still watching A Good Life, the health show with me, Pooja, and we are having a fruitful discussion with Dr. Mridu Plaban Borah, pediatrician from 𝗟𝗡𝗥𝗧𝗛𝗘 Hospital. So, doctor, coming back to you again. Now, we had an idea about what exactly the fever would be seen in children and what would be the symptoms that the parents will have to take care of it. Now, if we also ask about the checking of the temperature, now, how often is it recommended for parents to check the temperature in children?
Right. So what I have already mentioned is that the common cause of the fever in children is the viral cough and cold or seasonal fever. So we have to check the temperature whenever you suspect that there is fever. So many times actually the parents do the wrong thing is that they just touch the body and that they feel that actually the child is having fever. Actually it's not like that. So before that actually we have to know what is the exact temperature beyond which actually we can tell that the child is actually having fever. So in a normal child, actually normal active child, if you just come even when there is no fever actually, if you just go on measuring the temperature, we can find that there is a fluctuation of the temperature all over the day. So in the morning actually they have got a low body temperature. In the evening hours actually they have got a bit high rise of temperature. High in the sense that body temperature is a bit high. So it's not like fever if there is activity is normal. So usually 98.6 till 99 we don't call it that it's a fever. So in a child who is very much active actually, at times actually we can get 100.4 degree Fahrenheit, up to 100.4 degree Fahrenheit. A children below 5 years of age is very much normal. So whenever you suspect that if there is fever, probably when you suspect, then we should measure the temperature. And whenever you see that it is going above 100, then we have to call it as a fever. But when to give medicines? There is another question along with it actually. So if we find that the child is almost playful, even with a 100 degree Fahrenheit of temperature, so we need not have to give any medicines. So if it is going beyond 104, definitely we can think of giving medicines, but still, so there is a very tricky point in this positions actually is that, so we have a immune system in our body. So what happens when there is a entry of virus, when there is a entry of bacteria and which causes infections, and because of the infection we are having fever, which with a mild rise of temperature actually our immune system gets activated. So our body works very efficiently. So our defense system becomes activated and we can kill the virus or we can kill the bacteria. But if we give the medicine in a lower degree of temperature, actually we are doing harm to the children.
Okay.
So the best thing is that whenever you feel that the child is having 101 degree Fahrenheit of fever, definitely we should give medicine so that we can lower the temperatures. Lowering the temperature is like that, it's not treating the infections. So actually we are helping the children so that the child is comfortable with the fever, right?
Okay.
So we can check the fever at 2 hours interval or 4 hour interval or 6 hour interval whenever you suspect, and accordingly we should give the medicine whenever it is indicated.
All right. Now, doctor, there is a term called febrile seizure, which is also seen amongst the children when they have high fevers. So what is this febrile seizure?
Yeah, it's a very, very important topic actually. So febrile seizure is one of the conditions actually. At the immediate rise of temperature, some of the children actually between 6 months to 6 years of age, in this age group, the children suddenly they lost consciousness.
Okay.
They throw seizure-like activities actually. So it's not actually seizure, but it's because of the fever. So we call it febrile seizure. So during the height of fevers, some children they throw fever, they become unconsciousness. So if you just if I would like to explain it in a very common language, sometimes there is a uprolling of the eyes, there is a stiffening of the limbs, and sometimes they become unconscious.
Okay.
So that is a very, very critical situation for a parents, or a new parents typically, or the children, the older child shows the symptom for the first time. So many parents actually they get panic. This is called febrile seizure. Many times actually it's fever, it's associated with fever, and if we just lower down the temperature, the symptom subsides. So it usually sometimes lasts for only 3 to 5 minutes, and sometimes it may be prolonged, like 15 minutes or half an hour like that. But if it is prolonged, definitely child should be taken to the hospital for immediate care.
Okay.
But if it is very short period of time, for 3 minutes or 5 minutes like that, now parents need not have to say. But the only thing what we can do, or we can help the child, is that we should keep the child in a right lateral or left lateral positions.
Okay.
Whatever the water it is available nearby, actually it can be a jar or whatever. So we should take normal tepid water. It should soak into the in a handkerchief or in a towel, and we should just wipe the child so that the temperature goes down. But in those situations, if you try to give some medicines, actually the medicine will take time 10 to 15 minutes to just lower the temperature. But
Okay.
medicine at that moment probably may not be helpful. So you have to lower down the temperature by cold sponging. That's all. It's okay. So it's not, the parents should not get panicked. But the thing is that it's a very, very benign condition. There's many times if it occurs for the first time, probably the parents should approach the pediatricians to get the details knowledge of the conditions. And I think it should not panic. And what we can do at home is the cold sponging and keeping the child in the right lateral and left lateral positions. Many times actually children cleanses their teeth. Actually there might be some tongue biting, there will be some fruiting from the mouth. But we should not panic. We should wipe out, and we should not try to open up the mouth. But the only thing what we can do, that sponging the baby, we should try to lower down the temperature. Within 2 to 3 minutes, probably the child will be comfortable.
Okay.
That is febrile seizure, and usually with every episodes of fever, so the febrile seizure can happen. But actually it happens in the first day of fever. It can happen even in the second day of fever. It can also happen in the third day of fever. But by the time the parents become more conscious, probably in the second day and the third day, the chances are very less.
Okay.
So whenever the parents comes to us with a history of febrile seizure, I usually just make them warn or make them aware that be careful in the first day of the fever, because many times actually when the febrile fever occurs, actually the parents become very much conscious and they said, oh, डॉक्टर ने तो मेरे को बोला ही था ডক্টৰেটো মোক কৈছিলে যে এনেকৈ ফাৰ্ষ্ট ডে হ'ব পাৰে একচুৱেলি কি হয় যে ফেব্ৰাইল কনভালচন হোৱাৰ পিছতে তেওঁলোকে বেছি কনচিয়াছ হৈ যায় ছাৰে কোৱাৰ পিছতো আমি বেছি মন নকৰিলোঁ বাট দ্য থিং ইজ ডেট ইফ ৱেন এভাৰ ইউ ছাছপেক্ট ডেট দেৰ ইজ ফিভাৰ প্ৰবলি উই শুড মনিটৰ দ্য টেম্পাৰেচাৰ এণ্ড উই শুড গিভ মেডিকেশ্যন এজ পাৰ ইণ্ডিকেটেড
All right.
So probably thereby we can prevent febrile episodes in later life.
All right. So, doctor, what would be the key points that the parents will have to remember while tackling a child with high fever? What would be those key points, doctor?
Yes. A high fever, you see, so what I have already touched upon that if there is associated some dehydrations. So when the dehydration can occur. Number one, if there is gastrointestinal tract infections, if the child passes lot of loose stool or the child vomits too frequently, child may go into dehydration. In those situations, probably because of the dehydration, this child can have a high grade of temperature. And if the child is very sick and he is not able to take orally, even the solid or the liquid intake is very, very less, the child may go into dehydration and child can have high grades of temperature. Probably during the episodes of fever, we should give small frequent amount of more of liquid diet so that we can maintain the hydrations. Many times, if we take the example of measles, if we can take the example of Rhesiola infantum, those situations, what we can find that the child actually have high grade fever during the first 3 or 4 days of episodes of fever. So after that, the rashes appears and the fever goes down. And during the first 3 days or 4 days episode, what we have already discussed that it can throw scissors for small size, small children between 6 months to 6 years old. So we should be careful in that part that the child should not throw scissors.
So basically, doctor, proper hydration for the child is very important.
If we feel that child is very sick,
Doctor, proper hydration for the child is very important. That has to be taken care by the parents.
Last thing what I should mention, parents and the regular monitoring of the fever, and we should give paracetamol from time to time. Then next very important thing is that if the child is very sick and the fever is persistent, all the time the fever is almost 100, 203 like the fever, and the fever is coming very frequently, every 1 hourly or every 2 hourly fever is coming, and the child is not taking orally, and there might be some other symptoms like there is extreme headache, there is extreme vomiting, there is earache, there is respiratory difficulty, there is child is very lethargic or child is throwing seizures. Probably these are just some alert symptoms when the child should approach a doctor or they should go to a hospital.
All right, so these are few of the points which the parents will have to remember while tackling a child with high fever. Thank you so much, doctor, for those advice and for those valuable information at this point in time. And well, viewers, with this we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.